The escalation of gun violence was a major focus for this year's Chicago Urban Summit that brought together pastors, youth, young adults, and other people of faith to address the crises. This year's theme was Faith in the Public Square, becoming prophetic, pastoral, and political church. The Northern Illinois Conference of the United Methodist Church sponsored the weekend. Let's welcome 3 participants in the summit. Reverend Andrea Davidson is senior pastor at Hartzell Memorial United Methodist Church in Chicago. Reverend Dr. Rodney Walker is pastor of Grace Calvary United Methodist Church in Chicago and executive director of the Albany Park Community Center. And Dr. Colleen Cicchetti is director of the Center for Childhood Resilience at Ann and Robert H. Lurie Children's Hospital of Chicago. Can you share some highlights from the Urban Summit?
We're thrilled to have the Reverend Dr. Aubrey Hendricks, who's a professor at Columbia University, come and share about the ministry of Jesus and how churches are called to live into not only a pastoral ministry, but also begin to take on a more truth-telling ministry that Jesus had, as well as one where we are willing to get engaged and be about public change. And so that was tremendous to have a great scholar sharing with so many lay folks and hear how their Bible translates to a different kind of Christianity than many have heard before. Likewise, there were amazing workshops on each track.
Okay.
So the prophetic, the pastoral, each one helping folks have tools to take home that they would be able to make a change in healing their communities.
Oh, it sounds very exciting.
Yes, correct. And one of the highlights were tracks focused on how do we confront Pharaoh. So how do we help churches and congregations and lay people look at structural change and working not only to mobilize individuals, but how do we focus and work with change over a lifetime directing public policy, how to get folks from out of the pew into the public arena to help address and readdress some of these policy conditions that we're facing.
So that's where the political track comes in.
That's where the political track came in. How do we organize, how do we work with our partners, such as the Community Renewal Society and Soul and Iron and other advocacy groups to really help the congregation, lay and clergy, understand how public policy affects our lives, and then how do we restructure those policies to make them more holistic and that they will be more helpful for our people.
Okay, and then could you say something more about how violence is a part of this subject?
One of the tracks looked at violence in the medical arena. So we had a nurse who worked in a psychiatric unit of a hospital talk a lot about trauma and how trauma affects those in the community, the families, those people who witness the trauma, and what is the church's response? How can we partner with our health institutions, Children's Hospital, and really look at making a difference in the community with the families that we serve.
Dr. Cicchetti, could you tell us about the Center for Childhood Resilience?
Absolutely. The Center for Childhood Resilience is really the public health arm for the Department of Psychiatry at Lurie Children's Hospital. And we really are interested in, we know that what we can do to help kids that are suffering from stress, distress, and challenges at the hospital, but we also know most people never make it to hospitals. In fact, about 20% of kids who need mental health services in our country ever get it. So we're really about the business of how do we take what we know works and collaborate with community partners and folks that work with kids in lots of different settings to try to promote mental wellness and health and to address the impact of trauma and stress in our communities as well.
Oh, it's so important. Can any of you speak to the interdisciplinary component of this? We've talked about nurses and healthcare. Who else might be involved in this type of work?
Well, many of our pastors and our colleagues across our conference looking at how do we help our churches become trauma-informed congregations. So how do we take the gifts and the talents of our mental health providers and train our congregations to how to use prevention tools and resources, and then how to make those referrals. So how do we connect the dots with those who are in the village?
And I can tell you about a partnership that we have to actually take materials that we've been developing as part of I'm not sure if you know, but the city has declared that we are going to become a trauma-informed city. The Department of Public Health wrote that into Healthy Chicago 2.0, and it is something that we've been working on for many years across the city. And so we're very excited about that. And one of the things that we're doing is trying to create a set of tools that can be used to share this message of what it means to be trauma-informed, both the lens and also what the practices might look like in various settings. So we are currently partnering with Reverend Beekman to develop these materials with a plan of then piloting them at several different congregations and creating these teams that would be both social workers from some of your child serving agencies that work with the Methodist Church and the faith-based leaders to actually go in and deliver these together. So it would be taking some of our expertise, but really melding it with the messages and the priorities of the faith community and creating some materials that could go out to that faith, especially to start with as a pilot, and then hopefully sharing that with the city and hoping to replicate that in other communities as well.
Wonderful. Do any of you have any stories to give us an idea of what this might look like? From
our perspective, when we think about trauma, what we're looking for is trying to teach folks that work with anyone, whether it be in a youth organization, a child organization, a community organization, to start being able to recognize signs and symptoms of distress, and also to be almost using a universal precautions approach, which is to say that if you're working in a community that's been impacted by a lot of poverty and years of distress, that the best way to do it is to approach everyone and to create a couple of things. So when we talk about trauma-informed settings, we're talking about three main things. We're talking about a place that's safe, both physically and emotionally, a place where you're really building connections and relationships that are going to help break down some barriers. And then the final one is some skills around self-regulation. So thinking about no matter what setting you work in, are you helping people to learn how to manage their emotions and get upset or sad or agitated, but then to be able to find that inner peace and calm down. And in some ways, churches are such a natural place to do that. And
the word sanctuary keeps coming to my head.
Yes, sanctuary is a big word for that. So that's what we're talking about, is that it might look different in every type of setting that works with different kinds of, in whatever way you work, but trying to build those three common areas. And that's really become a model that we're trying to replicate, not just in the faith community, but also in the parks, in the police, in the libraries, in the schools.
So sometimes that may look like a safe haven, that may look like an after-school program that's hosted at a congregation. For others, it may be a mentoring program. But how do we use our sanctuaries as safe spaces, as places of healing all over the communities that we serve?
Another aspect of the interdisciplinary work is really looking at the tools of the church. So we study Bibles, right? On Sunday morning as we gather and worship, we talk, we read the Bible, and we study it during the week. And how does the Bible inform our work as a community? And likewise, a part of this task in our summit was to help folks to see that the study and the proclaiming of the Bible, the prophetic, is not antithetical to the political, because I think we get sometimes that churches or Christians should not be engaged on the political sphere. But what did they say? All politics is personal, right? And so what are the ways in which communities of faith can understand that they are powerful? And what are the ways that we can, as pastors and as communities of faith, not only share with one another, but share with our community about what are the struggles, what are the things that we are afraid of, what are the things that we are passionate about and want to transform in our community. Most of what we heard when we began to talk about this was community safety. I mean, the increasing violence in our city is such that folks are really concerned for their own lives, but also for their children's lives. Can my child get to and from school safely without being shot? And so then what happens when you have a community of people who are willing to say, this is what is critical for us, and we are willing to get some more folks who are very passionate about this as well, and then go have a conversation with our elected officials and say, this is a priority for us, and this is what we need. And so a part of the work was to help the faith community understand its power and give it some tools to be able to coalesce and move that power in directions that transform and heal our communities. There's so much to be done, and the church needs to be a part of that. Faith communities need to be empowered to do that work.
I'm so grateful for all the wonderful work that you are all doing. Thank you for being here, Dr. Cicchetti, Dr. Walker, and Reverend Davidson.
Thank you.
I'm Polly Toner for Different Drummers and the Greater Chicago Broadcast Ministries. Keep the faith.